Hello, I'm Alan Small, speaking on behalf of the Ontario Libertarian Party. Like many of you, I hate lineups, whether they're in supermarkets or traffic jams. But traffic jams or long supermarket lineups are just minor inconveniences. They are entirely different than waiting in a hospital emergency room or for necessary surgery. I'm sure you will agree that the sense of being out of control while waiting for medical care can be unimaginably stressful and cause great mental anguish. Lengthy waiting periods are among the most common citizen complaints regarding the Ontario healthcare system, and it's likely going to get worse as the boomer generation gets older. That's why you need to continue watching and listening to the information that follows. Our system of universal access to health care is often compared to our American neighbors. But the truth is it bears little resemblance to it. It's a bad comparison. Most democratic countries around the world have universal access to health care, but they do a far better job at delivering it than do Canadians. So let's compare those places to Canada. Let's compare apples to apples. Here's an interview with Jerry Agar from Talk Radio1010 in Toronto. He will introduce Nadeem Esmail of the Fraser Institute. Please listen and watch.
So it's well known, and it's believed by many in the United States and most in Canada that it's working just so well that we have the best healthcare system in the world. And I have certainly experienced that if you suggest otherwise, it's like you'd made some sort of crude suggestion about the individual's mother. People get so furious about it. So why don't I direct the fury away from myself and over to the Director of Health Policy Studies at the Fraser Institute, Nadeem Esmail. Good morning.
Good morning.
Am I correct that some people will just be furious you even suggesting somebody might have a better healthcare system?
Absolutely. And, oftentimes it's a misunderstanding thinking that what people are proposing is a move away from universality where really there are other countries that just do so much better at delivering universal access healthcare than we do. And it's well time we started understanding that lesson.
Well, sure, but you're making a comparison to Japan, and I think we've been hearing about some European countries recently, but Japan's experience, you write, shows it's possible to provide quality health care to all citizens regardless of ability to pay and at a reasonable cost to taxpayers and with a lot less wait times, apparently.
Absolutely. We spend, on an age-adjusted basis, about 87% more than the Japanese do on their healthcare system. And yet we have fewer medical technologies, fewer hospital beds. We have some of the longest wait times for healthcare in the developed world. And while we have more human resources in the healthcare system, we have similar healthcare outcomes, if not slightly worse than the Japanese healthcare outcomes. So they've clearly found a much more efficient way to do universal access healthcare than we have.
Well, you have a number of reasons. Let's take a look at some of them. The one that I jumped to, first of all, because this is the one that gets people so exercised, allow private provisions of hospital and surgical services. People will immediately, I'm talking to Nadeem Esmail, Director of Health Policy Studies for the Fraser Institute, and I'm sure you've experienced this, Nadeem, people will just immediately say, well, as soon as you let those greedy private entrepreneurs in there, the cost will just skyrocket and poor people will never get health care.
That's classic Canadian rhetoric, and yet even the Swedes have figured out that it's nonsense. The private sector is motivated by different things in the government sector in many ways and faces different constraints. And as a result, what you get is a more patient-focused experience when you have private providers in the system competing with public providers. In Japan, some 70% of Japanese hospitals are privately owned, and they have about 75% of the acute care hospital bed stock. So about three-quarters of the universal access hospital care sector is privately owned and operated in Japan. And remember, this is a hospital sector that does as well or better than Canada's in terms of healthcare outcomes and has no waiting lists.
That's just a dramatic thing to hear if you're in Canada. Has no waiting list. Are they doing that by kicking people to the curb, or are they actually treating people?
They're actually treating people. The volumes of surgery are higher. They have more capacity in the sector to take care of people. Japan is, in fact, one of several nations that has no waiting lists. Belgium, France, Germany, Japan, Luxembourg, Switzerland, and the Netherlands all have universal access healthcare systems without waiting lists. And at the same time, Japan and Switzerland end up at the top in international comparisons of healthcare outcomes, or health system performance. And the Japanese healthcare system is internationally recognized to be a very high-performing healthcare system. It is remarkably inexpensive. And interestingly, the Japanese do all of the things that the defenders of the status quo in Canada tell us would destroy Medicare. They have cost sharing, they have private competition, they have private financing. It's a very independent system from government, and as a result, it works better.
Well, here in Canada, you'll get provinces bragging about the fact that they cut the wait times down on such and such a procedure to 9 weeks only.
Well, and let's even look at the targets. The target for joint replacement in Canada, according to the Pan-Canadian benchmarks, is 6 months. It's 4 weeks for radiation therapy, and the care guarantees are 8 weeks for radiation therapy. The target for open heart surgery, elective open heart surgery, 26 weeks. Not only do we have a terrible waiting time problem here in Canada, we're not even willing to admit how bad it is, and we're setting these incredibly long and easy-to-reach targets, and we're failing to even meet those. I mean, this is a terrible situation for patients. But to put everything in perspective, the Canadian healthcare system is the developed world's most expensive universal access healthcare system on an age-adjusted basis. And according to study after study after study, we have some of the longest waiting lists for access to healthcare in the developed world. More management and more money is not the solution to that problem. We've got to start looking at countries like Japan, where universal access healthcare systems simply work better for everyone.
Well, what gets in our way?
I think a lot of it comes down to the false dichotomy that has for so many years permeated the Canadian debate over healthcare, and that is Canadians are often faced in the debate with a stark choice between the poorly functioning but at least universal Canadian healthcare system and the American healthcare system, which is not universal and can be quite expensive. But that's really not the choice we face, and Canadians have really been told a great lie here. Truthfully, there are so many other ways to do universal access healthcare when we look at countries in Europe, when we look at Japan, when we look at Australia. These superior approaches are not necessarily consistent with the Canada Health Act, but that doesn't mean that they're not good approaches to universal access healthcare. All these countries share the noble goal of Canada's healthcare system, access to care regardless of ability to pay in a time frame that provides comfort and peace of mind. The difference is that to the extent these countries have private hospitals, have cost sharing, have private parallel financing, they're doing a better job at delivering universal access healthcare services.
More in just a moment. Nadeem Esmail is with me, Director of Health Policy Studies, the Fraser Institute, as they tell us that Japan, among other nations, does a much, much better job delivering health care to their citizens on a universal basis than we do here in Canada. In-Depth Radio, News Talk 1010. I'm Jerry Agar, taking on this treasured Canadian healthcare system, which is dysfunctional. And it is dysfunctional to close your eyes, put your fingers in your ears, and go, la, 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 when anybody wants to tell you that there are better ways to do it. A system that thinks they're doing a good job if they get open heart surgery waits down to a half a year is not patient-centered. It is system-centered. And there are many nations that do a better job while providing universal health care. I'm talking to Nadeem Esmail, Director of Health Policy Studies, the Fraser Institute. They have a new report out comparing our system to Japan. And Nadeem, even as we're talking here, I'm starting to get text messages and emails explaining to me through complete economic ignorance why putting some sort of private enterprise into it wouldn't work. One of the problems we have, Nadeem, is Canadians don't even want to read a report like what you put forth and learn from the successful experience of other nations.
There is this fear of change in Canada, which is shocking, especially when the healthcare system performs so poorly, when the waiting lists in Canada are so long and in fact are killing people. The Supreme Court of Canada in 2005 recognized that waiting lists are killing people, and wait times haven't come down since then. They're just as long now as they were back then. We're condemning people to death in Canada through poor healthcare policy. Let's take an honest look at what's going on around the developed world. Even the Swedes have figured out that the private sector can play a strongly positive role in a universal access healthcare system to improve the quality of care, to improve accessibility of care for all, regardless of ability to pay. This is just smart policy.
Well, let me run through a few of your points here because I want to make sure I understand them. You have something we could do, cost sharing for all forms of medical services. What does that mean?
Well, in Japan, the universal health insurance system does not pay for everything up front. In fact, when individuals access the healthcare system for the first time in a month, unless they're in a state of low income or if they're children or elderly, they're going to be paying 30% of the cost of the healthcare service they consume. So, for example, if the physician consultation is $50, they have to pay $15 out of their own pocket. The insurance company will pick up the other 70% or $35.
So it's like auto insurance.
Absolutely, and that encourages people to make a more informed decision about when and where it's best to access the healthcare system. The evidence is very clear. This is not going to have a negative health consequence as long as there are reasonable annual limits in place, which there are in Japan, as long as low-income populations are exempt, which they are in Japan. This reduces healthcare expenditure. It increases efficiency through the healthcare system, and it's a policy that's pursued by the majority of developed nations within universal constructs, and it's a policy that's pursued by 100% of the developed nations who have better universal access healthcare systems than we do.
Yeah. By the way, it's also the way it works. I have to see the dentist tomorrow, and I will pay that sort of upfront fee. The insurance will then pay the rest of it. And we do have programs for kids whose parents can't afford dental care, but what we don't have is wait times for a dentist. You can find a dentist. You can't find a doctor in Ontario. Another one is largely private provisions of acute care hospital and surgical services. What does that mean?
That means that the majority of healthcare in the Japanese healthcare system is delivered by providers that are not owned and operated by governments. About 3/4 of acute care hospital beds are in the private sector. About 70% of hospitals are privately owned and operated. And funding for hospitals is done on an activity-based basis in Japan, which is also very important. The way we pay hospitals in Canada is backwards. Right now, we give hospitals a big bag of money every year and tell them to go look after people. Now, administratively and for governments, that's very simple to operate. But the downside is that for hospitals, reducing waiting times drains the budget.
Yeah.
Treating more people drains the budget. Attracting people to the hospital with more patient-focused services drains the budget. In Japan, because money follows the patient, the incentive is the exact opposite. It's more complicated to administer, but in Japan, if a hospital reduces wait times and attracts patients, it gets more money. And that really makes for a better universal healthcare system. It makes for a better hospital sector.
Well, you mentioned, as we're wrapping up here, Nadeem Esmail is Director of Health Policy Studies at the Fraser Institute. You mentioned that the Supreme Court of Canada recognized that that we're killing people with all of these wait times. We're doing something else as well, ultimately. We're making health care more expensive. People don't get healthier as they sit around waiting.
Absolutely, and they deteriorate while they're waiting, which means that they're going to require more complex care, longer surgeries at the end of that process. They're being put at risk while they're waiting, and there's a chance that they're not going to experience the same recovery, that they're not going to get back to the same level of health as if they would have if they'd been treated earlier. At the same time, what we never really think about is the personal cost of waiting, the mental anguish, the pain and suffering. Even if a person doesn't die, even if the recovery is the same, there's a very real personal cost in terms of mental well-being, in terms of engagement in daily life that comes from waiting from an untreated medical condition.
Nadeem Esmail, Director of Health Policy Studies, Fraser Institute. Thanks for your time.
Thanks for having me on the show.
Yep, appreciate it very much.
I hope that was informative. For more information on how to improve the Ontario healthcare system, visit our website and look under Platform. Thanks for listening.